When we talk about healthcare in the United States, two programs usually come to mind: Medicare and Medicaid. Both of them are government-run, both aim to help people afford medical care, but they are not the same thing. While Medicare is mainly for seniors and certain disabled individuals, Medicaid is designed with a different purpose in mind. So what exactly is Medicaid, who can get it, what benefits does it provide, and how does it compare to Medicare? Let's break it down step by step in simple terms. Medicaid was first introduced in 1965, the very same year Medicare was created. Both programs were signed into law under President Lyndon B. Johnson as part of the Social Security amendments. The difference was that while Medicare was a federal program intended to protect seniors, Medicaid was built as a joint federal and state program that would help low-income individuals and families get access to health care. In other words, Medicare is tied to age or disability, while Medicaid is tied to financial need. So, who exactly qualifies for Medicaid? The rules can vary a bit from state to state, but generally, Medicaid is available for low-income adults, children, pregnant women, elderly adults, and people with disabilities. For example, a single mother raising 2 children on a very low income may qualify for Medicaid so that her kids can get regular checkups, vaccines, and hospital care when needed. Similarly, an elderly man who doesn't have enough income to afford healthcare can qualify. Medicaid ensures that being poor doesn't mean being left without medical help. The eligibility for Medicaid depends on income level, and this is often measured in relation to the federal poverty level. Thanks to the Affordable Care Act, or Obamacare, Medicaid expansion allowed more people to qualify in many states. For example, in expansion states, adults earning up to 138% of the federal poverty level may be eligible. That's why Medicaid enrollment numbers have grown significantly in the past decade, because more low-income adults now qualify. Now let's talk about the benefits. Medicaid provides a wide range of healthcare services. These include doctor visits, hospital stays, long-term care in nursing facilities, preventive services like vaccines and screenings, and in many cases, even dental and vision care for children. One of the biggest differences between Medicare and Medicaid is that Medicaid covers long-term nursing home care, which Medicare usually does not. This makes Medicaid a crucial lifeline for elderly people who may need years of long-term care. Let's look at an example. Imagine Linda, a 45-year-old single mother with 2 children. She works a part-time job and struggles to make ends meet. Without Medicaid, she would have to choose between paying rent or taking her children to the doctor. But because she qualifies for Medicaid, her kids get vaccines, dental checkups, and treatment when they are sick, all without devastating costs. This shows how Medicaid doesn't just protect health, it protects families from falling deeper into poverty. Another example is George, an 80-year-old man with Alzheimer's disease. He needs long-term care in a nursing facility. Medicare would not cover the cost of years of nursing home care, but Medicaid steps in. Once George qualifies based on his limited income and assets, Medicaid pays for his long-term care, giving him dignity and support in the most difficult years of his life. Now, let's compare Medicaid to Medicare more directly. Medicare is a federal program. It works the same in every state. Medicaid, however, is run jointly by federal and state governments. That means the federal government provides funding and basic rules, but each state can manage its own program, set its own income limits, and even decide what benefits to include. That's why Medicaid in one state may look slightly different from Medicaid in another. Another key difference is that Medicare has parts B, C, and D, while Medicaid is usually one program, though it can include multiple services depending on the state. One question many people ask is, can someone have both Medicare and Medicaid at the same time? The answer is yes. This is called dual eligibility. For example, someone over 65 may qualify for Medicare because of age, but if their income is very low, they may also qualify for Medicaid. In that case, Medicare would cover many of the costs, and Medicaid would step in to cover what Medicare doesn't, such as co-pays, deductibles, or long-term nursing care. dual eligibility is a huge help for seniors living in poverty. It's important to remember that Medicaid is not the same everywhere, and that's part of both its strength and its challenge. The flexibility allows states to design programs that meet the needs of their residents, but it also means that the experience of Medicaid can feel very different depending on where you live. Still, across the country, Medicaid is the single largest source of health coverage for low-income Americans, covering more than 80 million people. In conclusion, Medicaid is a safety net designed to make sure that no one is left without healthcare simply because of their financial situation. From children to elderly adults, from pregnant women to people with disabilities, Medicaid provides essential medical services and peace of mind. It was created alongside Medicare in 1965, but while Medicare is based on age and disability, Medicaid is based on income and need. And yes, some people qualify for both, making sure the most vulnerable Americans don't fall through the cracks. So, the next time you hear the word Medicaid, remember that it's not just a government program, it's a promise that healthcare is a right, not a privilege, no matter how much money you make. For millions of Americans, Medicaid is not just insurance, it's survival.